Thank you, Mr Speaker.
Order.
My
Honourable Ruth
question is to
Dyson.
the Minister of Health. Is he comfortable with the numerous announcement of health cuts in the last 20 months?
The Honourable Tony Ryle.
Mr Speaker, contrary to the member's assertion, the health budget in the last 20 months has in fact increased by over $1.3 billion. There always have been and always will be changes to services reflecting changing needs. And this government is improving frontline services despite coming out of the worst economic recession since the 1930s.
The Honourable Ruth Dyson.
When he told New Zealand Doctor that cuts to community group funding pales into insignificance compared to more people getting elective surgery, what message was he sending to the 1,500 people with mental health and addiction issues who receive support from Aspire, a Wellington-based community group, who have had their funding reduced by 10% this year?
The Honourable Tony Ryle.
Mr Speaker, what I would say to those people is this government's investing an extra $174 million extra in mental health over the next 4 years. Significant gains are being made in improving mental health services for New Zealanders.
The Honourable Ruth Dyson.
What response has he given to the Hutt Valley judge who went public with his concerns about an offender who has been waiting for 8 months for an urgently needed bed in a mental health facility?
The Honourable Tony Ryle.
What's he done about
Mr Speaker, what I can tell that member, and I don't have the details of that specific case with me, but what I can say is we've put another $174 million into mental health services. More people are getting mental health services than ever under that failed party opposite.
The Honourable Ruth Dyson.
How will Capital and Coast District Health Board be able to support people with mental health in the community or in a mental health facility better, given their confirmation in writing to me that their mental health budget in the coming year will be almost $5 million less than in the previous year?
The Honourable Tony Ryle.
Well, Mr Speaker, the Capital Coast District Health Board's district annual plan has not been approved by the government. So whatever they're telling that member is not consistent with the facts as the Minister considers them.
Nikki Wagner.
Tēnā koe a kei mana whakawā. To the Minister of Health, what reports has he received recently on improving frontline services?
The Honourable Tony Ryle.
Mr Speaker, besides receiving reports of considerable improvement in mental health services around New Zealand, I can advise that there are a number of significant improvements over the last 20 months, a record rise of nearly 13,000 extra patients receiving elective surgery over the last 2009 year, much shorter waiting times for cancer radiation treatment, many more 2-year-olds fully immunised, and a significant investment in the major public health program to insulate New Zealand homes.
Question number 7, Chris Ochenvold.